NCLEX Exam Practice Test 2026, New, Real 25 Hardest Questions with Explanations. Question 1. A nurse receives 4 morning laboratory results. Which client should be assessed first? Option A, potassium 3.1 milliequivalents per liter. Option B, sodium 149 milliequivalents per liter. Option C, hemoglobin 7.8 grams per deciliter. Option D, calcium 7.9 milligrams per deciliter. The correct answer is option C, hemoglobin 7.8 grams per deciliter. A hemoglobin of 7.8 grams per deciliter indicates severe anemia and possible hemodynamic compromise. The risk of hypoxia requires immediate assessment and stabilization. Question 2. A client with COPD is receiving oxygen at 6 liters per minute via duct nasal cannula. What is the nurse's priority? Option A, increase flow to 8 liters per minute. Option B, switch to a Venturi mask. Option C, maintain the current rate. Option D, lower the rate to 2 liters per minute. The correct answer is option B, switch to a Venturi mask. High-flow oxygen can suppress the respiratory drive in patients with COPD. Venturi masks allow for a precise fraction of inspired oxygen to prevent carbon dioxide retention. Question 3. A postoperative client reports sudden chest pain and dyspnea. Which action should the nurse take first? Option A, obtain a full set of vital signs. Option B, raise the head of the bed. Option C, start oxygen. Option D, call the provider. The correct answer is option B, raise the head of the bed. Elevating the head of the bed improves lung expansion and oxygenation. It stabilizes the client while preparing for further medical intervention. Question 4. Which task is appropriate to delegate to an unlicensed assistive personnel, UAP? Option A, monitoring vital signs in a patient receiving blood. Option B, teaching incentive spirometry. Option C, feeding a client with dysphagia. Option D, assisting with ambulation after a safety assessment. The correct answer is option D, assisting with ambulation after a safety assessment. Ambulation is safe to delegate after the registered nurse assesses the patient's stability. Tasks involving evaluation, teaching, or unstable clients cannot be delegated. Question 5. A client on furosemide reports muscle cramps. Which laboratory value is the priority? Option A, sodium. Option B, potassium. Option C, bun. Option D, magnesium. The correct answer is option B, potassium. Loop diuretics cause potassium loss, which can lead to cramps, arrhythmias, and weakness. Checking the potassium level guides immediate correction. Question 6. A nurse receives a prescription for 60 milliequivalents of potassium to infuse over 30 minutes. What should the nurse do? Option A, administer as ordered. Option B, dilute with saline and give slowly. Option C, clarify the prescription. Option D, give oral potassium instead. The correct answer is option C, clarify the prescription. Intravenous potassium must never be given rapidly due to the risk of lethal arrhythmia. Extremely high infusion rates require clarification with the provider. Question 7. During a blood transfusion, a client develops fever and flushing. What is the nurse's first action? Option A, notify the provider. Option B, stop the transfusion. Option C, increase normal saline. Option D, administer diphenhydramine. The correct answer is option B, stop the transfusion. Stopping the transfusion prevents further progression of the reaction. The nurse should then maintain intravenous access with saline and notify the provider. Question 8. A client with diabetic ketoacidosis, DKA, is being treated. The nurse knows therapy is effective when which occurs? Option A, urine output increases. Option B, serum potassium drops. Option C, serum bicarbonate rises. Option D, blood pressure increases. The correct answer is option C, serum bicarbonate rises. A rising bicarbonate level indicates the correction of metabolic acidosis. DKA resolution is measured by the normalization of pH and bicarbonate levels. Question 9. A client with schizophrenia states, "The cameras inside my lungs are tracking me." What is the nurse's best response? Option A, that is not true. Option B, why do you think that? Option C, that sounds frightening. Tell me more about what you feel. Option D, ignore those thoughts. They aren't real. The correct answer is option C. That sounds frightening. Tell me more about what you feel. This response acknowledges the client's emotion without validating the delusion. It encourages expression while maintaining therapeutic communication. Question 10. Which client requires immediate isolation precautions? Option A. A client with an MRSA wound. Option B. A client with active tuberculosis symptoms. Option C. A client with C. diff diarrhea. Option D. A client with an influenza-like illness. The correct answer is option B. A client with active tuberculosis symptoms. Tuberculosis requires airborne isolation to prevent respiratory transmission. It carries a high risk for rapid spread. Question 11. A client on warfarin has an INR of 6.2. What is the nurse's priority? Option A. Hold the dose and notify the provider. Option B. Document and continue therapy. Option C. Administer aspirin. Option D. Increase dietary vitamin K. The correct answer is option A. Hold the dose and notify the provider. An INR of 6.2 poses a major bleeding risk. The medication must be held and the provider informed for potential vitamin K adjustments. Question 12. Which finding in a client with heart failure is most concerning? Option A. Crackles in both lower lobes. Option B. Weight gain of 2 pounds in 24 hours. Option C. Pink frothy sputum. Option D. Pitting edema in the legs. The correct answer is option C. Pink frothy sputum. Frothy sputum indicates acute pulmonary edema. This is a life-threatening emergency that requires immediate intervention. Question 13. A nurse is caring for a client on a heparin infusion. What is the therapeutic goal? Option A. APTT 1.5 to 2.5 times the normal value. Option B. Increased platelets. Option C. Decreased patient. Option D. BINR 3 to 4. The correct answer is option A. APTT 1.5 to 2.5 times the normal value. Activated partial thromboplastin time, APTT, guides heparin therapy. A proper range ensures anticoagulation without causing excessive bleeding. Question 14. A client with myasthenia gravis shows sudden difficulty swallowing. What does the nurse suspect? Option A. Cholinergic crisis. Option B. Migraine aura. Option C. Myasthenic crisis. Option D. Thyroid storm. The correct answer is option C. Myasthenic crisis. Swallowing weakness suggests a myasthenic crisis triggered by undermedication or stress. The risk of respiratory failure is high. Question 15. A nurse finds a client having a tonic-clonic seizure. What is the first action? Option A. Insert an oral airway. Option B. Turn the client to the side. Option C. Hold the arms and legs. Option D. Give intravenous diazepam. The correct answer is option B. Turn the client to the side. Turning the client on their side prevents aspiration and helps maintain the airway. Forcing objects into the mouth or restraining limbs can cause injury. Question 16. A child with sickle cell crisis reports severe abdominal pain. What is the priority action? Option A. Apply cold packs. Option B. Administer intravenous opioids. Option C. Encourage ambulation. Option D. Restrict fluids. The correct answer is option B. Administer intravenous opioids. Vaso-occlusive pain requires rapid relief with opioids. Hydration and oxygenation should follow, but pain control is the most urgent need. Question 17. A client receiving TPN develops sudden shortness of breath and tachycardia. What does the nurse suspect? Option A. Hypoglycemia. Option B. Fluid overload. Option C. Electrolyte imbalance. Option D. Air embolism. The correct answer is option D. Air embolism. An air embolism presents with sudden respiratory distress. Stopping the infusion and positioning the client are critical steps. Question 18. A client with end-stage liver disease has ascites and confusion. What does the nurse anticipate? Option A. High potassium. Option B. Elevated ammonia. Option C. Low bilirubin. Option D. High calcium. The correct answer is option B. Elevated ammonia. Hyperammonemia leads to hepatic encephalopathy. Confusion signals neurological compromise requiring treatment. Question 19. After administering morphine, which parameter must the nurse monitor? Option A. Reflexes. Option B, urine pH. Option C, respiratory rate. Option D, platelets. The correct answer is option C, respiratory rate. Opioids depress the respiratory center in the brain. Monitoring respirations ensures early detection of hypoventilation. Question 20. A client receiving digoxin reports nausea and visual halos. What should the nurse do? Option A, give the next dose early. Option B, hold the medication. Option C, administer potassium. Option D, increase fluids. The correct answer is option B, hold the medication. Nausea and visual halos are classic symptoms of digoxin toxicity. The nurse should hold the drug and notify the provider to check levels and electrolytes. Question 21. A diabetic client becomes confused and sweaty. What should the nurse do first? Option A, check blood glucose. Option B, call rapid response. Option C, give insulin. Option D, offer water. The correct answer is option A, check blood glucose. These symptoms indicate hypoglycemia. A rapid glucose check confirms the condition and guides immediate sugar replacement. Question 22. A client with severe pancreatitis suddenly becomes hypotensive. What might this indicate? Option A, renal colic. Option B, fluid shifting to third space. Option C, thyroid dysfunction. Option D, pulmonary embolism. The correct answer is option B, fluid shifting to third space. Pancreatitis causes massive fluid sequestration, or third spacing, which can lead to shock. Hypotension signals dangerous intravascular depletion. Question 23. A nurse prepares to administer intravenous vancomycin. What is the priority pre-assessment? Option A, blood pressure. Option B, lung sounds. Option C, kidney function. Option D, hemoglobin. The correct answer is option C, kidney function. Vancomycin is nephrotoxic. Checking baseline renal function ensures safe dosing, as impaired kidneys can lead to toxic accumulation of the drug. Question 24. A client with chest trauma shows tracheal deviation to the left. What does the nurse suspect? Option A, pleural effusion. Option B, tension pneumothorax. Option C, atelectasis. Option D, pneumonia. The correct answer is option B, tension pneumothorax. A tension pneumothorax shifts mediastinal structures, compressing the heart and lungs. It is a life-threatening emergency requiring immediate decompression. Question 25. After a thyroidectomy, a client develops tingling around the lips. What is the priority action? Option A, give pain medication. Option B, assess for cross-X sign. Option C, increase intravenous fluids. Option D, apply a warm compress. The correct answer is option B, assess for cross-X sign. Tingling suggests hypocalcemia resulting from parathyroid injury. Assessing for cross-X sign confirms neuromuscular irritability, which requires urgent calcium replacement.